So what does the data tell us? That we need to establish baselines. For us, that is crucial. We need to assess our employee needs and interests, and that our data will drive our interventions. And the next part of our structure is our policy team. Our policy team, its purpose is to identify, prioritize, and implement evidence-based strategies. Of the change package, this fits into the internal work environment. So our purpose is to create policies and environments that make the healthy choice the easy choice. These policies and environments will be based on the recommendations from the assessment and evaluation team. Kyle is the chair of this team. So far, we've done a health and productivity policy, and I've learned that policies don't happen overnight. When I first started sharing this, I was like, oh, we can wrap that up in a month. It doesn't. But also, I think one of the reasons that we're really successful with this team is that, so with our structure, yes, we have a policy team, but then we have a bigger policy team that sits at the agency level. So we have one of our team members actually sits on the bigger policy team. So he could say, hey, you know what, this is not going to pass the review process. This is what you need to change. And that's been really crucial for our success. The energizing meeting policy, that's been done. Right now we're working on a vendor use policy, which is going to put some guidelines and parameters on how we have outside vendors come in and do services for our employees. So I also provided a work plan of how we're going to come about that, because we thought we could just kind of put something in place. But then we realized that no, we have to have a guideline. You know, what's the RFP process going to look like? And you know, I don't think any other agency's really done anything like this. I've been trying to reach out to see. So if you guys have any suggestions on what works or doesn't work, share them with Kyle and I. And then with stress management, we realized that stress management is going to be key to our success moving our interventions forward. And that's actually one of our top interventions that we want to work on. So we need to have some kind of stress management policy or procedure in place. So that's currently what we're going to be looking on. We communicate through our health promotion team, which is our health promotion and programs. This fits into engage employees, effective wellness interventions, and community linkages. So we have a variety of venues that we actually do our communication with. Our Wellness Gateway is an internal intranet site that is available for employees to do. We do all of our communications through our website, and any emails that go out, any Sentinel articles, any posters, link them straight back to our intranet, and then we track to see how many times people look at certain sites to see what they need. So we know that once we launched the HWI, we put it on our website, so all of a sudden we had like 500 people within that day look at it. So we know that the communication is working. So it's just a matter of getting people to come to the website, and we just restructured it. So we're trying to see what works, what doesn't work, what are we missing. As we restructured it, we also realized that we left off certain links, and people called us and told us, hey, we're missing that link. So we're like, oh, okay, so people are looking, so they are using it. The DOH Sentinel, we've made a commitment to our communications office that we will submit 1 to 2 articles a month. And these can be random articles. They can be articles from the health promotion team. They can be articles from the assessment team, whatever we feel necessary. But we do make a commitment that we do have a standing spot every month in that. Informational flyers. We've got commitment from our facilities office that we can have stall talk, which is what we call it, is bathroom talk. We can have flyers in the bathroom stalls at all times. So we've got that captivated audience. So, and it works. And so we just let them know all the events we have going on and when we would like to have them in there.
Right now in the bathrooms, we're promoting the governor's health bowl.
We also, in 2 of our buildings, we have posters that have been in the stairwells since the buildings were created like 5 years ago, but the posters never changed. So we actually talked to facilities, and they said, oh, you guys can have those posters. So now we are making posters that fit into a normal poster size. So right now we're going to have one for the governor's health bowl in the stairwell. And we're going to have one for the flu shots. We're going to have different ones that are coming up. So we do have a variety of venues that work for our communication. And I think we're successful because we don't just target one form of communication. And I stole this from you, Bobby, when you were at DOH. So we will accomplish our long-term goals through policy and system change were not a traditional wellness program, and making the healthy choice an easy choice. Any questions?
Well, I'm quite sure by the presentation you can understand what I'm going to say. When we do collaboratives where we're helping to guide, you just have to let them come up. Yeah. Guide people to make change, guide teams to make change. We always try to have a team that is out ahead of the pack. And I think by that presentation you can see that the Department of Health is our model team. They're sort of modeling the behavior of where we would see agencies going. And I really appreciate you sharing.
Can I share another story?
Absolutely.
So when we had an employee who took the health risk assessment for the first time this year, and she felt a lump in her breast, and she wasn't really concerned about it. She was like, oh, it's small, I'm not going to worry about it. Well, then we had the on-site health screening, and she realized, I probably should go back in. Well, she ended up finding out that she had breast cancer, and so she actually got the lump removed, and she's in remission right now. But she said, thanks to this actual on-site screening, she probably never would have gone back to the doctor.
And thank you for sharing that story earlier, because I was able to share that with AGL leadership. Larry Briney from Spokane specifically asked, well, do you have any great success stories from the screenings or from the HRAs? And I was able to say, well, from DOH, and then I followed that up with CTLL and some of the things there. But that was very meaningful to them, and it was appreciated.
Well, and she now wrote, I actually put up a Sentinel article that she helped us write, because she wrote a little quote when we actually published it. So, but it's sharing those success stories of everyday employees and how your employees are being engaged.